a small enough group that we can be informal. So, I'm happy. Well, I'll try to stop after each slide and be sure people have an understanding of what's on it and have any questions. We could do that rather than waiting to the end. And just to let you know, I took the slides from several different presentations I've given, so you'll see that they're not formatted in some wonderfully great way, but because some slides come from different presentations. So forgive me for that. So my name's Alan. So if you have questions, you could just, whatever you want to do, raise your hand, go in the chat, say Alan, whatever you want to do is fine. And just my background, I'm in Delaware, live in Delaware, in Greenville, which is, I think most of you may know, is part of Wilmington. And my undergraduate degree was in mechanical engineering. I went to medical school at Brown. I trained in internal medicine, which is basically a specialist in the care of adults, kind of maybe the equivalent of pediatricians for younger people. I practiced what's called primary care internal medicine for about 20 years. And that during that time and then afterwards, I became a healthcare executive. And I did that in Connecticut and then in Delaware at Christiana Care in Northern Delaware. And in that role, I was responsible for managing a large physician medical practice. So, if any of you ever want a presentation on the American healthcare system and healthcare in Delaware, and you're not too bored by tonight, you can just get in touch with me and I can do that. I know that's not the purpose of your organization, but that's something I spent a long time doing. So a number of years ago, I became interested in climate change. I was always, and my family has always been outdoors oriented, and both with athletics and with travel and gardening and things of that nature. And I want to learn more. And so I've spent 10 or 15 years learning from some very smart people in different places, especially in the Northeast. One place I've learned is from an organization called the Woodwell Climate Research Center, which is in Woods Hole, Massachusetts. Another place is an organization called Physicians for Social Responsibility. And I'm on the board of Physicians for Social Responsibility. And I was the national president last year. And that organization deals with climate and health issues, as well as nuclear weapons, which probably not things that we need to talk about tonight. So here's kind of a summary slide of the health effects of climate change. So climate change is clearly temperature increase. And I have a slide in the next slide or two about the temperature increase in Delaware, sea level rise, and then changes in rainfall. And then there's those kind of catastrophic events, hurricanes, tornadoes, floods, fires, droughts. And although I won't talk very much about this, I think you're all aware the sea level is rising. Delaware has the lowest average altitude above sea level of any state in the country. It's also has one of the highest ratios of coastline to land area. So it's not the highest, but that means there's a lot of coastline in Delaware, and we're pretty low lying. And sea level is rising for a couple of reasons. And once again, I think I'm not going to assume you know this. I assume some of you know it, but maybe not all of you. But one is warm water, as the sea warms, it expands. So that's just a simple chemical, I think Boyle's law kind of thing. As water gets hotter, it expands. Second thing is kind of paradoxically, as that cold ice in the north and southern poles melts, that also raises sea level. Paradoxically, because that's putting cold water into the ocean, but we still have a warmer ocean. And then the other reason why it appears that our sea level is rising, especially in Delaware, is that our land is sinking, and that's called subsidence. So if you go further north than mid New Jersey and New York City, there were glaciers. And where there were glaciers, the land was compressed. And so in those parts of the country, actually the land is rising. But in Delaware and any place south, the land is sinking. And that's partly because of development. We're pumping out our aquifers, and the land is sinking because there's less water in our soil and underneath our soil. So not only do we have temperature increase, but we have rising sea level in Delaware. And then we have pretty much the same amount of rainfall in total as we had 10 years ago or 15 years ago. But what's happening is it's shifted to be rainfall, which is more torrential. So there's downpours, and it's coming later in the year. It's coming in the fall. And it's not coming as much in the spring and summer when we need it, when farmers and gardeners need it for their plants and crops. So we got too much rainfall happening at the wrong time of the year. And the impact of those on people's health, you get heat island effects, and I'll talk about that in a later slide. You get air pollution, both smog and soot. And once again, I'll come back to that. You get allergens, pollens, as well as more robust poison ivy. So that I'm not going to spend a lot of time on that unless you have questions, but it has been studied and shown that poison ivy grows more robustly than it used to because it has a longer growing season with more humidity and more heat. There are more pollens being put into the air by plants. Vector-borne diseases refers to things which are carried by animals or insects. So those are things such as malaria, dengue fever, Zika. 100 years ago, malaria was one of the prime causes of death in the United States, including in Delaware and New York City, for example. When mosquitoes were controlled, that didn't become as much of an issue. Now mosquitoes are living longer, reproducing more, and spread and living for longer periods of the year. Waterborne diseases, that's because of algae blooms, for example, red tide, other types of infections in the water. And then not so much so far right now, but the mental health and environmental mental health effects of people being driven from their homes. And it's becoming more of a concern, for example, in southern Delaware along the coast, Florida along the southern coast of the country, where homes are becoming inhabitable. So any questions on this slide? Once again, this is more of a summary, get introduced to the kinds of things we're worried about. So any questions before I go on? Nope. Okay. Once again, you may have seen something of this nature, but just in case, on the left-hand side, it's 1950. That's about the time I was born. Maybe your parents were born around then, or grandparents. In Delaware, the mean temperature was about 56 degrees. In the middle, 2020, the mean temperature in Delaware was about 58 degrees. Some of you may be healthy enough to live until the end of this century, or at least your children, if you have children, they will. That's 2100 on the right-hand side. The models tell us that the mean temperature will be someplace between 58 and 64 degrees Fahrenheit. So, on any particular day, a change from 56 degrees to 65 degrees doesn't seem like a lot, but that's the mean temperature, and that impact over time has and will continue to have significant effects. And this is publicly available information you can get from in different places, including the DNREC website, where you just Google, and you can look this up for any part of the country. Temperature variations, also look at things such as rainfall variations over time. So any questions about this? So basically what you know is the air is getting warmer, right? And it's pretty significant. So the consequence of that, so this is from a report called the State of the Air Report. It's an annual report put out by the American Lung Association. I'm not going to give you a lot of references tonight, but if it turns out that you're interested in any of the scientific background, you can email me. My email is on the first slide, and I'll get you the information. So you decide to write a paper for school, or you want to learn more in depth, let me know, and I can get you the specific information. But this once again is, this report is very available to to anybody. You just Google State of the Air 2020. It's put out each year by the American Lung Association, and say State of the Air 2020, American Lung Association, and you can look up any place in the country. So, if you have family that lives in Massachusetts or Virginia, California, you can look it up. Or you're thinking of moving there, right? Okay, so Jack, you're thinking of playing lacrosse at Middlebury in Vermont, or in UVA or someplace of that nature. You could look up the air quality, and let's say you're asthmatic, and that's really important to you, right? I'm not saying you're asthmatic, but if one of you or a teammate were, that might be important to you, right? So ground level ozone is also known as smog, and it's a consequence of heat and sunlight causing a chemical reaction in what's called volatile organic compounds, and the effects of automobile gasoline combustion, okay? Nitrogen oxide, basically, that comes out of those catalytic converters. So if there are more cars on the road, such as in Newcastle County, and if it's hotter, and you're going to get more smog. And so what the Lung Association tells us, that Newcastle County, and actually all the counties in Delaware, have pretty bad smog levels. So this is important for people, once again, who have to work outside or run around outside. People have asthma, chronic lung disease. And actually Newcastle County is the worst of the three counties in Delaware. And once again, you can look up Chester County if you happen to live there, or Delaware County in Pennsylvania, or Cecil County, or or Salem, wherever you happen to be. None of them are going to be pretty much significantly better than this because our air doesn't stop at the borders. It's regional, right? And I think the other significant thing here is the Lung Association has a warning level. And what they tell us is, you know, I think in 2020, I think that was when this data came from, or either that or 2019, there were 22 orange days, which are days that people with underlying problems, respiratory problems, really shouldn't be exerting themselves outside. And there was fortunately one red day. I'm not sure what a purple day is. It sounds pretty bad. Red day is like nobody should be exercising outside because of smog. So any questions about smog? So the other, if not, the other major pollutant is particulate pollution, also called, and this once again is from the State of the Air report. As you learn about this, you'll hear the term PM 2.5, which stands for particulate matter of 2.5 microns or in size or less. And that little thing at the bottom there gives you an idea of how, you know, what 2.5 microns is, and how it compares to you know, the size of a virus, the size of the bacteria. So it's pretty small. And why this is significant is that particles in the air, which are this size or smaller, can pass through the alveoli into the bloodstream. So I don't know where you are in studying biology in school, but the alveoli are those things in our lungs that allow us to take oxygen out of the air and put it into our bloodstream, and then take carbon dioxide out of our blood and lets us breathe it back out into the air. So those are pretty, that's where we have air exchange between the world and our body. And PM 2.5 is small enough to pass through the alveoli into the bloodstream. And therefore, it can go every place that the blood goes. So it can go into the heart, into the coronary arteries. It can go into the pancreas. It can go into the placenta, the circulation in the placenta of a pregnant woman. And all those things can and do result in disease. And once, just before I leave, PM 2.5 is what some people call soot. And this is from the result of burning fossil fuels, generally for energy, for electricity and power. Also from diesel buses, diesel and trucks. So that's stuff that maybe some of you still ride a school bus, but that stuff that comes out of the exhaust of the school bus, diesel school bus, or that black stuff that comes out of trucks as they race down the highway, that's soot, that's particulate matter. Some of that's small enough to get into your bloodstream. And, you know, fortunately, Kent County and Sussex County don't have too much problem with soot. Newcastle County does. And these measurements come from air monitoring stations that are set up by DENREC and by the federal EPA all across the state. So the Lung Association didn't make this stuff up. It took the data and then put it through their formula of what's good and for people's health, what's bad for people's health. So once again, Newcastle County, whether it's soot or smog, not so good. Folks downstate, Olivia, at least you have good air generally in terms of soot, right? And I don't want you to feel too good about that because it's probably nothing that you're actually doing in Sussex County. It's probably just the prevailing wind patterns. Because a lot of our soot, a lot of the coal which is burned for electricity in Delaware comes from Pennsylvania and Maryland and West Virginia and Ohio. So the prevailing winds are probably carrying that across Newcastle County, Delaware County, Chester County, off into New Jersey, and kind of missing southern Delaware. Okay, so any questions on this slide? Okay, cool. So, we've talked just a few minutes about, soot and smog not being good for people, for being at higher levels than we'd like in our air, and and that it can bother people who have other health risks. And so, just to give you an idea of this, and this is once again from that same State of the Air report. The population of Delaware, almost 1 million, right? A little bit more than half of that, those people live in Newcastle County. There are a lot of asthmatics in Delaware. And matter of fact, there are a lot of asthmatics across the country. So between children and adults with asthma, that's about 90,000 people. And that's typical for the country. About 8% of the people in this country have asthma. And that number's been increasing over the last 15 to 20 years. And there are some theories about why that is. We can, if you're curious, I can go over that. But we already mentioned bad air quality. That's one particular potential reason. More allergens in the air for longer periods of time. Some people have asthma because of allergens. COPD is called chronic obstructive pulmonary disease. Usually it's a consequence of smoking. It's what happens when the lung tissue starts breaking down because of the inflammatory effect of smoke. It can be nicotine, it can be other types of smoke, inhaled smoke. Heart disease, 70,000 people in Delaware. Those folks are more at risk if their lungs aren't functioning properly and they can't get enough oxygen in to supply their coronary arteries. About a third of Delawareans have been smoked at some time in their life. As you know, we'll talk about in a little while, the impact of poor air quality and also COVID on non-white populations and on people of lower economic means. So a lot of people in Delaware, over 114,000, who are below the poverty level, at or below the poverty level, and over a third of our population is non-white, so Hispanic and African American predominantly, and in Delaware, those are the predominant minorities in Delaware. And there's as you can probably guess, there's a fair degree of crossover between the non-white population and the people who are below the poverty level. And those folks, and also predominance of those folks living in our inner cities, where there, as we'll get into in a few minutes, there are reasons that the air quality, the air that they breathe in their environment is even more dangerous for their health. So it's kind of like a synergistically negative impact that can happen. So any questions about any of the things I have listed here? Okay. This is not Delaware in particular. I know the colors are a little hard to make out over the United States, but this is just looking at soot, PM 2.5, number of excess deaths per year, just because of PM 2.5. And fortunately, we don't live in China or India, where the color there is, many parts of those countries, the color is red, but you can tell it's not totally true blue in the United States, especially in the mid-Atlantic and in the coal and rust belt from the coast going out to Illinois and Indiana. So, it's not as bad as living in India in terms of the air that we breathe, and excess deaths, but it's certainly not as good as it could be. I want to just mention that the air in Delaware and across the United States is cleaner than it was 20 years ago. So we should have some hope that that's possible. And do you folks know what RGGI is? The Regional Greenhouse Gas Initiative? Okay. Well, I'll briefly explain that. So the reason I bring it up now is it's one of the reasons why our air is cleaner. So basically, RGGI is a cap and trade that was instituted in the Northeast about 15 years ago. And the leadership of most of the Northeastern states got together and said, we want to limit the amount of carbon that we're putting into the air. And they created financial incentives. They sold credits, and those credits could be traded. Now, once again, this kind of gets into economics, and I'm not an expert in that, but and you can learn more about. But if you want to learn more about it, you would look up Regional Greenhouse Gas Initiative. One reason this is important is it has had a good effect upon our air. There's some caveats. Pennsylvania never joined RGGI. Maryland is in it, New York State is in it, Massachusetts, Rhode Island, Vermont, Delaware, Connecticut. Pennsylvania never joined. And that's because politically, the administrations in Pennsylvania, because of fracking and coal mining, didn't want to put any limit on the use of fossil fuels. The current governor, Governor Wolf, is taking moves to put Pennsylvania into RGGI, which will be if that happens, should cause a great improvement to the air that we breathe in Delaware, if less fossil fuel is being burned in Pennsylvania. Once again, the prevailing winds is carrying that to us, right? The state legislature in Pennsylvania is fighting. So we'll see what happens, right? New Jersey, fortunately, we don't breathe the air from New Jersey because the winds take it away from us, unless some of you live in New Jersey, where your families live there or relatives live there. New Jersey was in RGGI, and under Governor Christie pulled out of RGGI for political reasons. Now, the current governor, Governor Murphy, is putting New Jersey back into RGGI. The reason I'm spending so much time talking about RGGI is that this is a tool that can be used to increase or to decrease the cap, the amount of carbon which is permissible to put into the air in the states that produce the air that we breathe in Delaware and in New Jersey and New York, et cetera. Okay. So any questions about RGGI? There'll be, and once again, if we don't do anything, things will get worse, because as it gets hotter, we'll be creating more smog because of the action of heat on car exhausts and on volatile organic compounds. Volatile organic compounds are things like what's in paint. So oil-based paints, for example, okay? Okay, so a couple of things. Actually, let me just check the time. Okay, we're okay. Just a little summary slide about the things that outdoor air quality can do. Both soot and smog. Once again, they can cause and increase asthma. They can make it harder for people with chronic lung disease to breathe. They can cause heart attack and stroke because from a couple of different effects. One is the inflammatory effect of that particulate matter going into the coronary arteries and into the arteries in the brain, and also because they interfere with the oxygen getting into the bloodstream. They've been linked to early onset of diabetes because of the inflammatory effects of soot in the arteries to the pancreas. They've been linked to poor outcomes of pregnancy because of PM 2.5 getting into the placenta of pregnant women. And just so and I don't want you all feeling depressed by this stuff because the reason for tonight is for you to learn enough so you can use it in your advocacy, talking to your friends and families and teachers, and it can help you and other people communicate the issues better, and the reasons why there's the things we should and can be doing to make things better. So Delaware has one of the highest infant mortality rates in the country. And so, and the drivers, and that's, per rate, meaning per, say, 1,000 pregnant women. And the drivers of that is in our inner cities. So if you look at the zip codes in Delaware with the highest infant mortality rates, it's downtown in Wilmington, downtown Dover. And think back to what we were saying earlier about people below the poverty level, people who live in, and we'll talk soon, people in areas where there's poor air quality, who may have more underlying disease to begin with, where there may be heat islands. And we'll get to that a slide about heat islands in a moment or two. So there's all these things which are contributing to poor outcomes of pregnancies, especially in our urban areas in the state. So that's another reason to be concerned about the air that people are breathing. Another issue, which is that indoor air quality is also an issue, and that is from burning, generally from burning, for the purposes of tonight, burning natural gas, burning propane and natural gas for our cooking on our stoves and ovens. Some people burn natural gas in their homes for heat. So indoor air quality is also has been identified as an issue for health impact. Heat. Some recent studies have shown that inner cities can average 5 to 20 degrees Fahrenheit hotter temperatures in the summer than their suburban neighbors. And this is called the heat island effect. And the reasons are all the blacktop in inner cities, parking lots, roads, rooftops on, for example, warehouses or factories. All that blacktop absorbs heat. It doesn't reflect it as a lighter or a green or a white surface would. It's called the albedo effect, ALBEDO effect. It's dark surfaces absorbing heat. And you probably know it yourself. If you go outside on a sunny day and you're wearing something black, you may feel hotter than if you're wearing something white. So hopefully the uniforms you're wearing for track or lacrosse are black on a hot sunny day. So there's blacktop, there's less trees and green surfaces in inner cities. So the green is more reflective of sunlight, but also trees and greenery because of the respiratory effect of trees breathing in carbon dioxide and putting out water vapor and oxygen, lower the temperature. So that's why if you have a lot of trees around your house, the temperature is generally around 5 degrees cooler than if you didn't have those trees, or then the people in the next town who don't have a lot of trees in their community. And extreme heat is an impact to people who are running around playing sports, who might have to work outside, do manual labor outside, older people whose circulatory systems can't regulate their body temperatures as well. So that's an issue. The way that we regulate our temperature and keep us close to a 98.5 degrees normal temperature as a human being is twofold. We sweat it off, and that's actually the main way. And we sweat it off because blood vessels near the surface of our bodies dilate to allow heat to come out of our bloodstream, and allow us to sweat, and also to through convection directly through our skin. So this is an issue for older people and people who have to work or play outside. I mentioned briefly vector-borne diseases, mosquitoes. There is now malaria in the United States. There's certainly Zika. You heard about it a couple of years ago. Now in the United States, those things probably would have been very difficult to be in our environments, other than the fact that things are getting warmer and more humid. But there's also, for example, Lyme disease and tick-borne diseases. The Lyme season is longer. Ticks are less likely to die because of cold weather in the winter now, because the weather is not as cold. So there's more Lyme disease, and the range of the Lyme tick has spread as the weather patterns have changed. So I'll leave it at that. Any questions about Lyme or tick-borne or mosquito-borne diseases? Okay. I meant to ask, are any of you asthmatic? You don't have to say if you don't want to. I'm asthmatic. I have exercise-induced asthma. So, I'm one of those 8% in Delaware. So I'm still, very physically active, but, it is something that maybe some of your teammates use an inhaler before a track meet or lacrosse or whatever you're playing. It's hard to understand what an asthmatic feels unless you've experienced it yourself. And what we're doing is we're making our air more dangerous for 8% of our population. Just another slide, which I think I'll quickly skip, because pretty much saying the same thing about mosquito and tick-borne diseases. So go on. So Jack mentioned that want to talk a little bit about COVID. And I think the nasty thing that we've seen, we've seen a lot of nasty things, but one nasty thing we've seen is people in the inner cities and people with underlying health problems, such as lung and heart disease, had more problems with COVID. They're more likely to get sick, clinically sick from it, meaning symptoms, and they were more likely to die from COVID. And not just in this country, but all over the world. And what's thought, and there's a difference in science between correlation and cause. Correlation meaning this happens and that happens. We're not quite, and we don't know whether one caused the other. Sometimes, and cause is, we know that one thing would not have happened without the other. So early in science, when things are being studied, sometimes the best you can say is that there's a correlation, but not a cause. When I was taking care of patients, I would often say that there's people who have blonde hair, very often have blue eyes. There's a correlation, but one didn't cause the other. It so happens that the genes for each of those happen to run together, to be grouped on the same chromosome. So they kind of travel together very often. But one didn't cause the other. But as the science of certain things becomes more sophisticated and you have more time to study it, then you can learn what's cause and effect. So for this one, it's been shown scientifically that soot, PM 2.5, is causal for premature respiratory and cardiovascular mortality, meaning people dying. Globally, the impact is similar to the effect of cigarette smoking. So even if you don't smoke, but you breathe dirty air, your chance of dying from lung and heart disease is as great as if you did smoke. And if you do both, you're even worse off, right? And that's been known for a long time. Coal miners, for example, those who smoked and worked in the coal mine, they were much more likely to get black lung disease, chronic lung disease, and to die prematurely than people who just had to breathe the coal dust and didn't smoke. It's also been shown that the risk of lung infections, any lung infection, viral pneumonia, bacterial pneumonia, is higher in geographies where there's more soot. And once again, as we talked about before, there's also a correlation between more soot and COVID. And the reason that it's thought this happens is that both the PM 2.5 and the coronavirus that causes COVID increase the activity of a receptor in the lung that causes inflammation. So it's not that the soot just gets into the alveoli and gets sucked into the lung. What's happening is the soot is activating a receptor on the surface of the lung, and that receptor is actually welcoming the soot and also the coronavirus into the lung tissue and into the bloodstream. And so it turns out that these effects are synergistic, meaning 1 + 1 = 3, not each one individually having an impact. And then it's been shown once again, and this is a correlation at this point, that for every 1 microgram per cubic meter increase in long-term ambient meaning the amount that we're breathing in the air of PM 2.5, there's about an 11% increase in COVID-19 mortality. And that's been shown, that correlation's been shown all over the world. So basically, the dirtier the air, the more likely you're going to die from coronavirus. And unfortunately, along with other factors, that's one of the reasons why we have more problems in the inner cities and of people of color, because our air quality in those communities tends to be worse. And for a number of reasons, I'll get to some of those in a moment or two. And just to let you know, 1 microgram per cubic meter, that's on those red days that I showed earlier, that's what our air quality is. It's our normal air quality when on a good day has about 12 micrograms per cubic meter of PM 2.5 in our air. On those bad days, it can be 15 to 20. And if that's persistent over a period of time, then that's what long-term ambient increase means. The statistics so far is that about 18% of the COVID-related deaths in the United States are thought to be related to air pollution. In some parts of the world, is thought to be about 25%. Fortunately, some places, lucky enough to live in New Zealand, it's going to be less than 18%. It's about I think 6 to 8% is the impact of air pollution on COVID mortality. So if we had clean air, what the statistics are saying is it may be that 18% fewer people would have died, and that would have been a whole lot of people, right? Because over 550,000 people have died in this country. So, this is getting into a little detail, and you can look at this afterwards. Don't feel that you have to understand it all now. But physicians and people in healthcare are generally not just interested in fixing people up when they're sick or injured. In the best of cases, they're interested in preventing people from getting sick. And we know that there's a disparity in the level of health of people of different races and ethnicities in the United States. And that's called a health disparity. And we know that some of that difference is not because of their genetics. It's not because of their exposure to an infectious disease, although with COVID, that is the case. But it's because they may have poor nutrition, a lower, be living in substandard housing that has allergens or mold in it, or that's not properly heated or cooled, or they live places where the temperature is higher because it's the inner city where the air is dirtier. And so health equity is the concept that for everybody to be healthy as possible, we have to do our best to get rid of health disparities. And I want to make a point here that health equity is not just helping people be healthier, that individual be healthier or their family be healthier. It also has a socioeconomic effect upon neighborhoods and regions and countries. The cost of an asthmatic going to the emergency room because they live someplace where there's mold or it's very hot or the air quality is poor, the cost of that person being in the emergency room or being in the hospital because of their asthma is monumental. An emergency room visit for an asthmatic can easily be $2,000 or $3,000. That's money that's being paid through insurance premiums by our families. It's money that's being paid through our taxes for Medicare and Medicaid, who's paying for that care. And one thing about that was found through Reggie, is that the savings in Delaware alone was tens of millions of dollars just by cleaning up our air and decreasing the number of people who needed care in emergency rooms and hospitals for respiratory and heart disease. And if any of you are interested in this, there's a report that was written analyzing the impact of Reggie in the entire Northeast and state by state. So you can look up Delaware and it tells you specifically how many fewer people went to the emergency room over 5 or 10 years, et cetera, for conditions which are related to air pollution. So, and I know Jack said that some folks might be interested in environmental justice. Just want to share this definition that comes actually from the federal EPA, Environmental Protection Agency. And once again, I think the work you're doing is exceptionally important. it's not just the individual helping, and that's exceptionally important to help individuals, but you're helping families and communities. You're helping yourself and your own families, even if you're fortunate enough to live in a nice, you know, suburban place or that has lots of trees, and your family, you have professionals and high income in your families. The air in Delaware is bad. It's causing your neighbors to be sick. It's causing expense that doesn't have to be spent to take care of people when they're not well. So that's a lot of issues there, and the implications. Sometimes, and I heard this a lot when I was in healthcare, is that, well, it's, why should I pay for that? And we don't begrudge people with diabetes the extra expense to take care of them. We shouldn't begrudge people who are unfortunate enough to live in places with this bad air quality, which is none of our fault. We didn't make the air today ourselves, right? As I've said, a lot of our bad air is coming from our neighbors. Of course, we're sending our bad air to New Jersey. But you can't begrudge people the resources that they need because they happen to be born with a genetic predisposition to something, or they happen to live someplace where the air coming into their community is bad. So that's the implication behind the need for environmental justice. So this is just a summary of all the things, unfortunate things that smog and soot do. I think you really have to pay attention to diesel exhaust. The diesel buses in Wilmington and Dover, the school buses, right? That your classmates who have asthma have to ride in, spewing out diesel exhaust. The highways which cut across our inner city communities. The coal and fossil fuel power plants. We do have a coal power plant downstate, right, in Sussex County, I think it's Indian River, right. They still burn coal there. Delmarva, which is our electric utility in the state, gets 20% of its electricity from coal. Some of that's from Indian River. A lot of it's from our surrounding states where Delmarva buys their electricity. So as you're working on your offshore wind advocacy, one thing you can tell people is, we have a lot of poor air quality days in Delaware. It's in every, especially in Newcastle County, but and that soot is coming, partly from the coal that's being burned, as well as the natural gas that's being burned by Delmarva for our electricity now. And we're making sick people in the state, and that's costing us all money and taking away opportunity from people to live a healthy, productive life. Delmarva gets another 40% of their electricity from natural gas. So 20% from coal, 40% from natural gas, about 35% from nuclear, which is from Salem County, mostly, and then only 5% from renewables. Nationally, averages 20% from renewables. We're only getting 5% from renewables in Delaware. Lower socioeconomic status is associated with greater harm from poor air quality. Part of that is from urban population living near busy roads. Lead is an environmental risk. I mentioned heat islands. I think all of you were born after lead was taken out of automobile gasoline, but that was a major source of lead poisoning in children, was from families who live near highways. And still in parts of the country, I'm not sure about Wilmington, if you test the soil in inner city neighborhoods near roadways, there's still lead in the soil. Lead doesn't disappear. It stays. It's a heavy metal. I spoke about heat islands. I won't get into the politics of that, but there is a reason why housing infrastructure is not as good in inner city neighborhoods. Substandard housing we've talked about contributing to asthma, food deserts, inadequate recreational and exercise facilities. And I think I already talked about this, but take a quick look at it and see if you have any questions. Almost done with the slides. And I think I've touched upon most of these things so far. Not only are there more emergency room visits from asthma and other respiratory diseases, there's more days lost from work and missed schooling. And once again, the Reggie report I mentioned, that details the changes in missed days of school and of work. And I just want to emphasize again, miscarriages, premature births, smaller babies. Smaller babies tend to have more problems than babies of normal birth weight. And probably more than you want to know, but there was a coal power plant in Lehigh Valley in Pennsylvania. And before it was closed down, there was a study done of women who gave birth in New Jersey downwind from the power plant. And they found a high level of miscarriages and problems with pregnancy. After the power plant was closed down, all those things improved. So they went back to what was expected. So once again, as you're talking to folks about why we shouldn't be burning coal and we should have renewable alternatives, here's another reason that there are people living downwind of Indian River and of coal power plants in Baltimore and in Pennsylvania. And you can Google where the coal power plants are and see where they are all throughout the country, and which ones are scheduled for closing and which ones are not. And here, this is another reason to be concerned about burning coal. I'm not a big fan of natural gas either. So, any questions before I go to the conclusions? No? Okay, cool. It's almost 9, so I think I have only 2 slides to go. Reggie, I already talked about that. Hundreds of millions of dollars of savings in Delaware because we're burning less. Our air is cleaner. And in the entire Northeast, $3 to $8 billion. That's, those have to be estimates. You can close coal power plants. That's been done all across the country by citizen activism. These power plants were located very often in where there are in cities. So in Chicago, Louisville, Bridgeport, Connecticut, Lehigh Valley. And it's been shown that things get better pretty quickly after those plants are closed. State and regional policy level, strengthen Reggie, get Pennsylvania involved, close those coal power plants. I already gave you these statistics about Delmarva. Green banking, I'm not going to go into that right now, but if you want to learn more about that, it's a concept of making low interest rate loans available to people to retrofit, to put their homes, do renewables, also do that for schools and public buildings. There's Energy Star standards for energy efficient homes. Delaware, 14% of homes built in Delaware in 2019. We're certified Energy Star. Pennsylvania's a laggard, but 44% in Maryland. Not sure why that is, but you would question why any homes are being built now which are not energy efficient. Community level, get people involved, get people involved in the community level, learn enough, through this mechanism. Both Yale and George Mason University have centers for climate change communication. Look at their websites. Yale has a weekly newsletter on climate change communication. Learn how to talk to people about climate change. Not everybody gets the same message. Some people don't know the facts. Some people have the facts but may feel powerless. So help them understand things that they can do. Some people are taking individual action but don't know how to get involved with an organization such as yours. So don't assume that one message fits all. And generally the message that things are bad and you're all going to die, that doesn't really help change people's minds so much. Doctors have used that for a long time. It's been proven it doesn't work by threatening people. You need to be realistic, give information, and then help people find a pathway for themselves as to what they can do to make things better. And both these resources, both Yale and George Mason, just looking at their websites, have a lot of information about what the public thinks, and how to have the conversation, how to provide information to people. And COVID, it is an issue. Unfortunately, I was on a webinar recently, and you've probably seen these numbers in the papers, but the number of people in our inner cities in Delaware and overall who have been vaccinated, the percentages is significantly lower than the percentage in the population in general. So, be as supportive as possible of getting vaccination sites in the cities, because if those people get sick, those are the people driving the school bus and working in the cafeterias and in the supermarkets. Those are the people who couldn't stay home from work, and you don't want those people getting sick because it puts you and your own families at risk. So there's a self-interest, enlightened self-interest, it's called, in being sure everybody is being as healthy as possible. That's it. About an hour. Do you have any questions? There were no questions. Anybody have any questions? And if you don't have to ask, but once again, my email's there. If you want to ask a question separately, or if you say, where do I find that Reggie report? Where do I find that information about the coal power plant in Lehigh Valley? Just email me. And some of it's really interesting, and especially as you're trying to influence people yourself to see how other people have done it, and how they've built coalitions. It turns out that sometimes the most powerful coalitions are those people who you think have no power. And so for example, the coal power plants in Chicago, which were closed down, they were in inner city neighborhoods, and there were high levels of asthma. And the people who lived in those neighborhoods got together with environmental groups and formed a coalition that together were more powerful than either alone, because they were able to make a personal story. My kid can't go to school, this many days a year because of her asthma. And some of those testimonials and how they did it might help inform you in your work. So anything you want to know that I haven't spoken about?
I just wanted to clarify something. You were talking about higher asthma rates in inner cities. Is that still directly related to diesel fuels and being around busier roads, or is there something kind of more underlying there?
There's several different reasons. Uh, One is, one of the big drivers of asthma are allergens. And when you often think of allergens, you think of uh, pollens, right? But they're also mold. So that comes from a poorly insulated, ventilated home. Okay. Uh, there's also uh, insect droppings. So I don't know if any of you ever lived where in a place where there are a lot of roaches. I have. I went to college in an inner city, right? And so, uh, but one of those reasons. So it's allergens, but it's not just allergens to pollens. It's to mold, uh, and it's to insect, and very often roach droppings. Uh, so, and so that's one set of reasons. Another set of reasons, yes, it is diesel exhaust, soot, smog, ground level ozone. Ozone up in the atmosphere, you've heard of the ozone level, right? If we didn't have a high atmosphere, upper atmosphere ozone layer, we'd all be fried because it protects us. But ozone at ground level, which is caused by sunlight and heat uh, on, on gasoline exhaust and volatile organic compounds, that's an irritant. We weren't meant to breathe ozone. They're supposed to be up there protecting us. But yeah, so it's ozone, soot, allergens, and not just pollen allergies. Um, Anything else? Any other clarifications?
This is I will say this is my last thing. I just wanted to kind of follow up on that. So a lot of the buses, it's being marketed as like take this, it's better than driving your own car, which I'm sure is true. But are there already alternatives out there for like diesel buses, and what kind of steps could we maybe try and take to kind of phase out the use of buses that are
Yeah,
detrimental?
there are alternatives, and some of the buses in Wilmington are hybrid buses. Uh, there's also now electric buses. Now, and in New York City and many, I think it might be in San Francisco, that in the next several years, there won't be any diesel buses. Now, that's tough for a poor city like Wilmington to do. Uh, but, I think certainly there can be a plan. And I think, folks like you who have to drive those, ride on those, maybe not you, but your younger siblings, those diesel school buses, you'd have to question why we're doing that, right? Or why we don't have a plan now that there are alternatives. And I think you've probably, I can't say for sure about diesel buses and gasoline buses, but we know that there was some recent studies showing that actually electric cars are more cost effective, meaning they're actually less costly over their lifetime than gasoline cars. So it might be a couple $1,000s more to buy initially, and that's an issue for people. And that's why there's a push for the federal government to subsidize, to more heavily subsidize electric and hybrid vehicles. But that is, but over the course of the 8 to 10 years that most people keep their cars, there's savings because you're not buying gasoline, and they're much cheaper to maintain. Uh, so there are federal funds. There's actually funds from that uh, carbon trading through RGGI that the state has, and some states are using those funds to subsidize buying uh, non-diesel buses. So that is an opportunity for the state to have a plan and not a 15-year plan. I'm not saying it doesn't cost money, but it's costing money now by having an unhealthy population, which will get worse. So, yeah. So there are lots of levels to this issue. There's the issue of what's good for the earth. There's the issue for what's good for your health and your neighbors and family's health. There's the economic issue. I think, Jack, you were on that Zoom session where they were talking about the renewable portfolio standard. Were you on that one? And some of the legislators were saying, oh, this is going to cost people money. So we don't want to have more alternative energy. We should just see what happens. Well, we're costing people money now. We're costing them because they can't go to school, they miss work, they're sick. It's going to get worse. And what we've seen through Reggie and things done in other parts of the country is that when we clean up the air, we help people economically. So it's an investment, it's not a cost. And so when people say that, say there's a cost to doing nothing, and we're paying it now. This is an investment that's going to pay us back. It's like putting money into any other good investment. But this one gives us financial gain and helps people have better lives. So once again, those are, that guy got away with it on that session. And all the people of his political party voted against, taking that motion out of committee and sending it to for a vote by the for the legislature, which passed it. Right, it was passed, but everybody from that party voted against it, and they got away with claiming they were standing up for the little guy. They weren't, because the little guy is hurting. And that's your job, is to get involved with the little guy, form a coalition, and be able to communicate these issues. Because it's never going to go away totally. You're going to have to keep fighting it for your whole life. It's like a chronic disease, right? You're not going to cure it. You're going to keep getting under control. Anything else? So what you're doing is great. And it's a school night. So, and you have practice, some of you have practice tomorrow. So get in touch with me if you need anything else. Okay?
Just thank you so much. I know I learned a lot.
Yeah.
Just thank you. And we know you're a busy guy. This is great that you took the time out of your schedule to talk to us. I really appreciate it.
Yeah. Well, hopefully it's something useful you can use in your work, or
I think so.
Just knowing more for yourself. That'd be great.